Good afternoon, everyone, and welcome to today's session. I hope you all enjoyed taking a online test together, competing with each other, the 300 MCQs. Let's take up the game for the discussion. Devi and Day, Nagesh, Kavya, and many more who are all online. Let's make the great beginning of this Sunday afternoon feast. A 44-year-old builder has acute low back pain and he is finding difficult to walk and had an urgent referral. You are able to see there is a distension. So what is that clinical symptom which is an ominous sign in this given patient that warrants you to do an urgent referral? So if there is any retention of urine, if the bladder retention is there, with the low back pain, inability to walk, everything falls into cauda equina syndrome, and that requires basically a referral. A 65-year-old man typically is having left ventricular hypertrophy. Left ventricular hypertrophy. So how do you want to, what is the single most important risk factor for the development of stroke in this patient? It is that high blood pressure 165 by 105 is considered to be the risk factor for the development of the stroke. A 17-year-old girl, she wants to get information on the vaccine, and what you are able to see is cervical dysplasia. So the vaccination is 99% effective in preventing the cervical abnormalities which are caused by the human papilloma virus types that can lead to cervical cancer, and she being 17-year-old is very much eligible to have it, is what you are going to counsel her. A 22-year-old, typically on the peripheral smear you can see the intra-erythrocytic parasite, which is typically only two organisms are intra-erythrocytic, inside the erythrocyte. Babesia and malaria. So that is the reason you need to take the history, whether she has traveled to any endemic area where the malaria is there. 18-year-old with sore throat, fever and malaise, and the monospot test is positive, that is infectious mononucleosis. Typically, infectious mononucleosis lead to development of splenomegaly. That's the reason he need to avoid the contact sports. Otherwise, there is a risk of development of spontaneous splenic rupture is what you need to remember. What are the most common false localizing neurological sign, doctor? Diplopia is the false localizing neurological sign. Can the online students can punch whether the voice is loud and clear, doctor? Yes. Can you please punch whether the voice is loud and clear for all of you? Yeah, very good. So, it's clear, very good. So, which is not a side effect of growth hormone. Growth hormone, catecholamines, glucagon, they all lead to hyperglycemia, not hypoglycemia. All the remaining things like gynecomastia, slipped capital femoral epiphysis, pseudotumor cerebri, they're all the side effects of the growth hormone administration is what you need to remember. Good. Thank you, Nagesh, for loud and clear. So, you guys should give me a feedback. Any of you have taken AIMS exam? What time is AIMS exam actually today? Is it morning or evening? And morning you all have played poll everywhere. The full-scale NEET test competing with one another. How did you feel about pole everywhere kind of a competition, kind of a test? Did you like that? Compared to Kahoot, what is your opinion? Yes, doctor. So, it is basically called the Jod-Basedow effect. That is, occurrence of hyperthyroidism with the supplemental iodine in the people who are endemic in an area of iodine deficiency. Typically, it is called Jod-Basedow's phenomena. Polling is very good, sir, says Devayandi. Chinnappa is saying AIMS exam is 9 to 12. Huh? Okay. So by now, all our guns of Neuron must have returned from the war, and by evening we will be knowing how was the question paper, right? So you can recall some of the questions and post, and we will try to accumulate and aggregate all the questions recalled, and then we will have a discussion, right? So very good. Now, so you all liked the polling method, the poll everywhere for conducting the grand test. I hope you enjoyed. Very good. Ammaji Nagreddy, your opinion is very much required. So how do you feel? Poll everywhere. Did you get a good feeling of competition, attempting along with everybody? Yeah, that's good. Nagesh is saying, I'll send you questions on the WhatsApp. Very good. Chinnappa is saying, all anatomy questions today are image based. Very good. Excellent. So, cardiac arrhythmia, rhythm seen in hyperkalemia. Hyperkalemia can cause ventricular fibrillation, sinus bradycardia, sinus arrest, but not torsidis depointis. Torsidis depointis is typically seen in case of hypokalemia, is what you have to basically remember. So, very good. Even Padma is saying, poll is very good. Excellent. Thank you very much for a good response. So, what are the drugs that lead to torsidis? Polymorphic ventricular tachycardia, amiodarone, ibutylide, erythromycin, haloperidol, droperidol, sotalol, myocardial ischemia, hypokalemia, hypomagnesemia, hypocalcemia, anything that prolongs the QT interval. Yes. Is the one which leads to development of polymorphic VT. Prolonged immobilization, it typically leads to development of hypercalcemia. If you do overcorrection of CTEV, clubfoot, typically you get rocker bottom feet is what you need to remember. Ossification center of scaphoid, it's a dirty numerical that you need to remember up to 4 to 6 years. High mortality and morbidity, typically whenever pelvic acetabular fracture occurs, then the pelvic structures like bladder, everything get affected. So that is the reason it carries a very high mortality. Tarso-metatarsal amputation. What is that called as? It is called Lisfranc's amputation, is what you should remember. So this is how the tarso-metatarsal amputation, Lisfranc amputation is being carried out, and after carrying out the Lisfranc's operation, you can see how the typical limb looks like, is what you need to remember. Kienbock disease होता है, lunate, osteochondritis. What is motor cyclist fracture? Since you all have answered the question paper, I'm trying to really run fast, right? So that's the reason. 10 a.m. to 2 p.m. take opportunity through poll everywhere, right? So you all know the link. So you participate in the test, compete with everybody. Up to 700 people can concurrently compete. the test. So once you finish, while you are listening this discussion, this does not look very fast. It will look optimum, right? So hinge fracture at the base of the skull, typically at the level of the base and the middle cranial fossa, the fracture is called motorcyclist fracture, is what you need to remember. What is a grade 4 burn? Skin and subcutaneous tissue involvement is called grade 4. Bogdelic hernia, you have to be very sure on this, doctor. Bogdelic is the most common fetal congenital diaphragmatic hernia. It is common in the left side. It is posterolateral, poorer outcome. You can remember, left is heart, dil ko kuch ho gaya to purna, right? So poorer outcome, and it presents earlier, much earlier. Morgagni is less common, it is anterior, it presents later. That's what you need to remember. Hernia occurring in the potential space posterior to gastrojejunectomy. What is that proper noun? What is it basically called? It is called Peterson's hernia, is what you have to remember. So typically, there can be a mesenteric defect through which internal herniation can happen. It can be internal mesocolic, or it can be Peterson space, or it can be jejunectomy mesentery. So that's how the various internal hernias occur, is what you need to remember. So what situation do you do circumcision? Circumcision is good for phimosis, paraphimosis, severe balanitis xerotica, not for penile cancer. Already penile cancer developed, no use. But circumcision provides a protection against the development of the cancer. What is the most common cancer in the men? It is the prostate cancer. Virchow's nodes are left supraclavicular nodes. What are the contraindications for the breast conserving surgery? A very, very interesting question. Once more, doctor, you should know all the list of conditions emphatically. For the breast conserving surgery, multicentric tumor, whenever you do a breast conservation surgery, if you found a positive margin of excision, if the size is more than 4 centimeters, if it is an advanced stage, if there is no access to radiation, or if there are any contraindications for radiation, like SLE, rheumatoid arthritis, scleroderma, pregnancy, prior chest irradiation, they are all contraindications for breast conserving surgery, is what you need to remember. But what is the advantage of breast conserving surgery? It will maintain the appearance and function of breast. Whether you take modified radical mastectomy or breast conserving, when you compare the disease-free interval, it is same in both of them. That's the point you need to remember. Now comes the Vipoma, Vada syndrome. What is that called? Vada syndrome. That is WDHA. Okay. Watery diarrhea. Then hypokalemia, flushing, achlorohydria. The combination is called as the Vada syndrome of Vipoma. Now gastric cancers may total gastrectomy. Where is it preferred, doctor? Typically it is preferred in the case of the proximal cancer, is what you need to remember. Very good to see 43 online students on the Sunday evening there, right? And I'm very sure some of you enjoyed taking the AIMS entrance exam in the morning today, and sure, by Wednesday we will be getting the reconstitution of the recall of the question paper, and we will definitely have a Dharmagaram Chai Pe Chircha on the AIMS question paper. So now, doc, Asiatic cholangitis caused by clonotic sinuses. There is a risk of developing cholangiocarcinoma. It is also called oriental cholangitis. Obviously, when bile duct is having any inflammation, it leads to development of jaundice, is what you should remember. Congestive splenomegaly, typically in Budd-Chiari syndrome. So Budd-Chiari syndrome, what happens, doctor, in case of Budd-Chiari syndrome? So you have the liver. From the liver, hepatic vein drains into IVC. IVC drains into the right side of the heart. So any hepatic vein thrombosis will lead to increased pressure inside the hepatic sinusoids. So how is portal vein formed? It is you have the spleen. From the spleen you are getting the splenic vein, and you have superior and inferior mesenteric vein. Mesenteric veins and splenic vein combine to form portal vein, which drains into the liver. So if the hepatic sinusoid pressure is high, portal vein cannot drain, and that will have a back pressure on the spleen, leading to congestive splenomegaly is what you need to remember. What is the watershed area in the marginal artery of Drummond? Typically it is at the splenic flexure. Charcot's triad include what, doctor? Jaundice, fever and pain is called Charcot's triad. Varioliform gastritis. What is the meaning of varioliform gastritis? There will be nodules, thickened folds, erosions. So typically erosions, if you do endoscopy, there is a lymphocytic infiltration into the gastric epithelium. So varioliform gastritis is typically seen in the case of lymphocytic gastritis is what you need to remember. Please drop a word in the WhatsApp study groups that the live class has started so that your classmates can join. Right? Now, normal portal venous pressure कितना होता है डॉक्टर? 5 to 10 millimeters of mercury. Normal ECG, X-ray, but symptoms look like heart disease. Where do you see? Like palpitation and everything. Panic, in panic attack. In Wernicke encephalopathy, confusion is the most common symptom. What is the type of memory loss and vascular dementia whenever the person gets a stroke leading to vascular dementia? It is called stepwise progression of dementia, is very classical feature of vascular dementia. What is delirium? Delirium is an organic brain disorder, is what you need to remember. Hypnagogic hallucinations. Typically, when falling asleep, if you get a hallucination, that's called hypnagogic hallucination is what you should remember. Diacetyl morphine is the other name given for heroin is what you should remember. Psychological dependence classically is seen with the cocaine. Consciousness is altered in the case of the delirium. Whereas dementia, amnesia, depression, in such cases may consciousness is not affected is what you need to remember. So what is the absolute contraindication for electroconvulsive therapy? There is only one absolute contraindication, doctor. Raised intracranial tension. Everything else is a relative contraindication. So cardiovascular, cerebrovascular, pulmonary diseases, they are all relative. So you should remember any recent MI, recent stroke, space occupying lesion, recent intracranial hemorrhage, active bleeding, pheochromocytoma, retinal detachment, severe liver disease, they're all relative. Only raised intracranial pressure is the only absolute contraindication for the electroconvulsive therapy is what you should remember. Morbid jealousy कहाँ होता है? Typically those who are alcoholic, they will have morbid jealousy developing. Personality change, where do we see, doctor? In case of schizophrenia, there's a change in personality. Suppose it is a paranoid type of schizophrenia. The person starts doubting everybody, which is not characteristic of his personality. Anorexia, versus bulimia. The way the food is being handled, that is the fundamental difference between anorexics don't eat, bulimics eat and vomit, purge. So that is the fundamental difference. Sweaty bodies, where do we see, doc? We see in case of lichen planus. So in lichen planus, what do you find? Wedge-shaped hypergranulosis, dermoepidermal junction become obscured because of the lymphocytic infiltration, and all those dead keratinocytes are called sweaty bodies, and there is a thick band of lymphocytes, They're all the classical features that you see in case of lichen planus is what you should remember. A 35-year-old male, multiple sex partners, comes with urethral discharge. What is the best treatment? Don't think it is only gonococcal. Think possibility of a chlamydia also. Both ceftriaxone and doxycycline, both need to be given. In pneumoniosis, there is a painless ulcer, indurated base, easy bleeding, beefy red lesions. They are all the features, but not inguinal swelling. 30-year-old had sexual exposure to a commercial sex worker, painless indurated ulcer on the glands after 3 weeks. Hard chancre is the syphilis, is what you should remember. In pemphigus foliaceus, acantholysis, where do we see, doc? We see it in the stratum basale, is what you have to basically remember. Pitted keratolysis, what does it affect? Pitted keratolysis. It affects the palms, it affects the soles. So this is how you get, doctor, pitted keratolysis. It is actually a bacterial infection. Pitted keratolysis is a bacterial infection, is what you need to remember. Foul odor, small discrete pits in the plantar tissues of the toes and feet, is what you classically come across. Very good. Almost 60 online students, right? So, in spite of AIMS exam, so most common site of involvement in lichen planus, it is the flexor surface of the upper extremities, whereas dermatitis herpetiformis will be extensor surface. That is what you have to remember. Lymph node involvement, where do we see, doc? We see it in chancroid, lymphogranulum venerum, TB. We see the lymph node involvement. Pseudocovenous phenomena, typically seen in the case of the warts, plantar warts. So pseudocovenous means it is a similar morphological skin lesion along the lines of the trauma. It typically occurs in conditions like verrucae, molluscum contagiosum, warts. You find pseudocovenous phenomena following trauma, is what you should remember. Which is a melanizing agent. Psoralen is called melanizing agent. Which skin condition resolves on its own? Typically pox virus associated molluscum contagiosum, which is a topical corticosteroid. Clobetasol propionate is topical. From there is the diaphragm developed, doctor, septum transversum. Examiner is very gung-ho about the diaphragm, embryology, doctor. Be very sure. So it is the septum transversum, mesentery of esophagus, pleuroperitoneal folds, and mesenchyme of the body wall. They all contribute for the formation of the diaphragm, is what you have to ultimately remember. From where is septum transversum developed? It is the lateral plate of the mesoderm from which the septum transversum develops. Septum transversum is a thick plate of mesodermal tissue between the pericardial cavity and the yolk sac, is what you have to basically remember. Somites From where do they develop? They develop from the paraxial mesoderm. Doctor, there were 750 MCQs in anatomy coming from 30 topics that we have discussed, debated in that embryology. We have very extensively discussed. We have put up all that video lectures, PPTs for you to consume in the onlinembbs.com video library in the anatomy. Please take an opportunity if you are doing too many mistakes in embryology. What is the purpose of our Sunday grand test or our NEETPG full-scale grand test is, end of the test, end of the discussion, you should decide, okay, these are the 10 topics I am getting frequently clean board. Whereas all my classmates, friends, everyone is answering very good. So that should be the stimulus for you to go back and repair those 10 topics, right? So like that, every test के बाद 10 topics अगर आप खत्म करना शुरू करें तो nobody will stop you from becoming the topper, right, doc? So you need to be in very high spirit, full energy, enthusiasm. Next 45 days that are there, very good time, right? Those who might have taken aims today might have realized it. I can bet it and say all 200 questions come from those 300 top topics out of the 953 topics list I gave you. It's obvious, examiner has no choice. Once more, within a given topic also, you should very clearly know what are the specific points examiner is looking for. What are those tricky points examiner is looking for? You should kill all those MCQs. Now doc, how many somites develop in human fetus? 42 pairs. Septum secundum, it arises from the primitive atrium, superior parathyroid, from the fourth arch, inferior from the third arch. So third is up, fourth is down, inferior from third, superior from fourth is what you need to remember. PAX6 is the gene for eye morphogenesis. Inner ear, when does it develop? 20 weeks. This kind of dirty questions you have to be 100% sure about. So Saradi is saying today AIMS was very, very, very tough, sir. See, doctor, tough and easy all depends upon what level of preparation we are in, right? There are certain topics, once you are able to clean up the concepts, right? There are certain lists that you should not miss. Then for you, the question paper appears very easy. When we are in a little beginning stage of preparation, there are a lot of deficits that we leave behind in our 4.5 years of journey in medical school. So all those speed breakers will keep hitting us while we are answering the exam. There's only difference, it's only a relative perception. Which stage of evolution you are there in your preparation is the only differentiator, doctor. No worries, we will do an autopsy on what were the questions that came and what is the depth till which examiner could be able to go. But let me tell you, if AIMS question paper in the 1 to 10 scale, you call AIMS as 10, don't forget, NEETPG will be only 6 to 7 in that scale. Be very sure. Because AIMS does a lot of exercise in order to create the question paper. It's altogether good if it is a clinically oriented question paper, right? If there are clinical vignettes, you can be able to sniff and smell what examiner want. It's very easy to answer. Single liner MCQ paper is much more difficult relatively. That's the point you need to be very sure about. Rostral neuropore. You all know that there is a telencephalon, diencephalon, mesencephalon. Telen is more rostral. So typically it is the lamina terminalis which is the remnant of the rostral neuropore is what you need to remember. Wow, Raghav is saying high anion gap was asked, which we discussed yesterday night. I am telling you, no, acid base disturbances without two questions, examiner chodega nahi. At least one question on ECG will be there. Without that, there is no question paper. Like that, you can easily predict, doctor, easily predict. No big deal about it. So, but the only thing is, at least one round, 30,000 MCQs of the last 15 years. AIMS, All India, PGI, JIPMER, FMG, DNB, right? Question bank, topic-wise classified and discussed, debated. You need to run through. Then automatically you will get that killing spirit, ability to eliminate, know what examiner is looking for. I am very sure today AIMS must have had a question on glomerulonephritis. Without a question on glomerulonephritis, examiner chodega nahi. Without a question on leukemia, examiner chodega nahi. Without a question on contraception, examiner chodega nahi. Like that, you can be able to guess 200 out of 300 what examiner inevitably is going to ask you. That's the reason, if you have not yet got those 953 high yield topic list in descending order of priority in each subject, please call our helpline 9000 868 356 and get that PDF. And also you can go through this topic list on the onlinembbs.com video library. Very good. Sarathi is saying Alport syndrome was asked. So now, doctor, there are two neuropores, anterior and posterior neuropore. Anterior neuropore closes by day 25. Posterior will close by day 28. So there are two holes, front one, back one. Justice Majumdar is saying Addison's disease is also there, obviously, right? So you are all in the WhatsApp study group. So please punch a quick recall on whatever that you could be able to recall, the questions into the WhatsApp study group, and then we will take it from there. Now, anterior neuropore is anencephaly, posterior neuropore, if it doesn't close, it will lead to spina bifida. And at 10th week, telencephalon contains two lateral outpocketings. The median portion of the lamina terminalis and the cerebral hemispheres. So that is the reason lamina terminalis is the remnant of the anterior neuropore, is what you have to remember. Ventral mesogastrium, dorsal mesogastrium, what are the derivatives is a favorite question of the examiner. Falciform ligament. So you should remember ventral mesogastrium, falciform ligament, right and left triangular ligaments, superior and inferior layer of coronary ligaments, lesser omentum, they are all formed from the ventral mesogastrium. What are the derivatives of dorsal mesogastrium? Greater omentum, gastrosplenic linorenal ligament. So typically spleen, gastrosplenic omentum, linorenal ligament, greater omentum, they're all derived from the dorsal mesogastrium, is what you have to remember. Arch of aorta. How is it developed from? Fourth arch artery, dorsal aorta, left horn of aortic sac. So the normal left aortic arch is derived from left branch of trunco-aortic sac, left fourth arterial arch, left dorsal aorta, and aortic portion of the embryonic truncus arteriosus. They all give rise to the aortic arch. Definitive renal artery ultimately arises from aorta. The male and female differentiation of the fetus. 10 to 12 weeks is the time. From where does the vagina develop? Favorite question of the examiner. Paramesonephric duct. So you should remember the paramesonephric ducts are also called Mullerian ducts. Mesonephric are called Wolffian ducts. Mesonephric, otherwise called Wolffian, typically lead to men. Paramesonephric called Mullerian lead to women. That's the point. Paramesonephric gives rise to fallopian tubes, uterus, fundus, body, cervix, and also upper part of the vagina, vaginal fornices, it will be giving rise to. So typically uterine tubes, fallopian tubes, uterus and upper vagina, they are the ones which are derived from the paramesonephric duct is what you have to remember. So uterine tubes, uterovaginal primordium, it differentiates into uterus and superior part of the vagina. So if you look at the vaginal development, doctor, upper 1/3 comes from the fused paramesonephric duct, uterovaginal canal. Whereas lower 2/3 of the vagina, it develops from sinovaginal bulbs. Sinovaginal bulbs are the evagination from the pelvic part of urogenital sinus. So typically lower 2/3 urogenital sinus, upper 1/3 from the Mullerian ducts, that's the paramesonephric ducts. That is how the vagina is being formed. Progesterone will peak by what time, doc? By the 21st day, 14th day of ovulation, samjho. Within 7 days, progesterone will support. If the implantation doesn't, if the fertilization doesn't occur, then the progesterone levels will typically fall down, leading to menstruation. Vasopressin. Vasopressin is ADH. ADH reduces the rate of urine formation. It acts on the V2 receptors. It is the paraventricular nucleus which leads to the formation of the vasopressin. That is what you need to remember. What is the purpose of incretin? Incretin. Some of you should tell me, Gerlin and orexin. Are there any questions in the today's aims? Because a lot of research goes into obesity. Obesity nowadays, so you have to be quite sure. It is one question I am hoping for, right? So, incretin increases the insulin secretion is what you need to remember. So, incretin increases the insulin secretion is what you should remember. So, Justice Majumdar, you should tell me what was the question on infertility in the today's exam. Infertility ke bina aims nahi hoga. Right. So, in diseases of growth hormone, how does cell death occur? Apoptosis. Once more. Apoptosis, I am betting definitely one question should be there. What is that question? Leukemia, one question should be there. What is that question? You have to tell me. I am like Andaraj Dhritarashtra. I am like a blind king Dhritarashtra. I have to listen to what you say. You are like Vidura who have gone to the battle and came back. Now, in diseases of growth hormone, cell death occur by apoptosis. Special protein for motility of the sperm, क्या होता है? Dynin. What do corticotrophs produce? ACTH, beta endorphin and CLIP. So you should remember pro-opio-melanocortin gives rise to gamma melanocyte stimulating hormone, ACTH and beta lipoprotein. ACTH will give rise to in turn alpha melanocyte stimulating hormone and CLIP. CLIP means corticotropin like intermediate peptide is what you have to remember. What does oxytocin lead to? Oxytocin leads to ejection of the milk, not production. Production is by prolactin. It leads to induction of labor. It attaches to the V1 receptors. That is what you need to remember. What is the major in vivo pathway for the coagulation? So there is an intrinsic, extrinsic pathway. So extrinsic pathway is the in vivo pathway. Prekallikrin to kallikrin require Hageman factor. Hegeman factor होता है, factor 12 is what you should remember. To treat the pain, we use 10 transcutaneous nerve stimulation. Nerve stimulation. What is the half-life of prothrombin, doctor? 60 hours is the half-life. Whereas the micturition center, voluntary control of the bladder, it is the medial frontal cortex, which is the micturition center, is what you should remember. Endorphin release will kill your pain. So it provides the analgesia, is what you should remember. Plasma membrane is freely permeable to alcohol. Lysosomal enzymes are very active with acidic pH. Curdling of the milk is because of the renin, is what you should remember. What is the function of corticospinal tract, called pyramidal tract? It controls the voluntary movement. What is medial lemniscus, doctor? Always lemniscus means it carries second order neurons. So your cuneate, gracile, they are all called dorsal columns. They will end up in the lower medulla, and from there they decussate to opposite side and pass as the medial lemniscus, is what you have to remember. You find one lateral lemniscus in auditory system. Factor 9 deficiency, hemophilia B. Typically, APKT is the one. Lead-on mutation, where protein C, protein S go and denature the factor 5. But if the factor 5 is resistant to the action of the degradative action of the protein C, protein S, you call it as factor 5 lead-on mutation, which is basically a missense mutation when the factor 5 is getting created. Blood group antigens are fundamentally what, doc? Glycoproteins. A 15-year-old girl, weakness for 2 months, and osmotic fragility test is positive, Coombs test is negative. That means it is not a autoimmune hemolysis, it is non-autoimmune hemolysis, which is seen in the case of hereditary spherocytosis, is what you have to basically remember. Increased MCHC. Typically in hereditary spherocytosis, the volume of the RBC become diminished. So the only anemia with an increase of MCHC is the hereditary spherocytosis associated anemia, is what you should remember. Acha bhaiya, this is the favorite question of the examiner. Batti marne wala matter aa gaya. AML, ALL. What are the good and bad prognostic factors? Preceding myelodysplastic syndrome become AML. So if there is a preceding MDS that is becoming AML, such an AML has got a bad prognosis. So previous MDS, previous chemotherapy, previous myeloproliferative disorder, that has got poor prognosis. Whereas if it is developing without any previous precancerous myelodysplastic syndrome, that it has got a good prognosis. So similarly, WBC count low is good. Trilineage dysplasia, all the 3 cell lines, bad. Translocations, T8, 21, 15, 17, inversion 16 are all good prognosis. So I leave this table for you, doctor. Hook or by crook, we have to master this and go for the exam, because this is one question which is going to come in the tomorrow's NEETPG exam. WBC counts, similarly in ALL, less than 10,000 is favorable. Females better prognosis. Splenomegaly Hepatomegaly, lymphadenopathy, unfavorable. Testicular involvement, unfavorable prognosis. CNS involvement, unfavorable. L1 FAB type is good, L2 is bad, is what you need to remember. Right? Very good. Majumdar rightly reminds, what is the translocation mantle cell, marginal cell? If the examiner one cytogenetic abnormality only, difficult to remember. Upar se, if he makes a full network of translocations and match them means too much. It's like a eclamptic pregnancy getting cardiac failure, right? Within a serious matter here. So ALL L3 type, it resembles Burkitt's lymphoma is what you need to remember. Owl's eyes are seen in which lymphoma, doctor? Hodgkin's lymphoma. Pancoast is apical tumor. It is a superior sulcus tumor, apical tumor, which lead to the typically seen in squamous cell carcinoma, leading to the superior vena cava syndrome. Shock lung is typically seen in ARDS. But this is a non-cardiogenic shock, is what you have to basically remember. Alport syndrome में what are the antibodies? देखो वहाँ एम्स में Alport है, हमारे संडे ग्रैंडस में भी Alport है, बढ़िया. So collagen 4 antibodies. Ballooning of hepatocyte. It is associated with non-alcoholic steatohepatitis, that's called NASH. Alcoholic liver disease, acute viral hepatitis, in सब चीजों में ballooning, this is called ballooning degeneration. In this case it is non-alcoholic steatohepatitis is what you need to remember. So where do we see Hurtl cells, doctor? In case of follicular adenoma, we find the presence of Hurtl cells. Pheome, what is the rule of 10? 10% bilateral, 10% malignant, 10% extraadrenal. You should be very sure about. One question on Men's syndrome or polyglandular autoimmune syndrome. I am very sure this is a very hot topic for the examiner. So typically you find PHEO, MCD, hyperparathyroidism in the Sippel syndrome. So medullary thyroid cancer, hyperparathyroidism, PHEO, Hirschsprung's disease, typically in case of men 2A, which is called Sippel syndrome. A 7-year-old girl, unilateral nasal obstruction, foul-smelling nasal discharge. What is your diagnosis? Always foreign body. A child is normal while crying, but if she is quiet, she is becoming cyanotic. Kyun? Why this colavaridi? Classical feature of choanal atresia is what you need to remember. Schluder's neuralgia, where do you see? Typically the middle turbinate pressing against the septum will lead to what is called Schluder's neuralgia. Bell's palsy may you give prednisolone. Frei's syndrome is auriculotemporal nerve. Cauliflower ear is the post-traumatic ear with hematoma. Carot's notch is otosclerosis. अभी बताओ, ENT में otosclerosis आया या नहीं आया? आना चाहिए, right? अगर आए तो क्या आया? Otosclerosis, Meniere's disease. They're the favorite areas of examiner. Cryptomagna. It is the remnant of second pharyngeal pouch. Typically the tonsils, they develop from second pharyngeal pouch. And in the extra embryonic life, the ventral part of the second Pharyngeal pouch is represented by the crypta magna, otherwise intratonsillar cleft is what you have to remember. Juncus diverticulum is the hypopharyngeal diverticulum is what you need to remember. Reactionary hemorrhage in tonsillectomy, it typically happens within 24 hours of surgery because of the improper securing of ligation. Now, what is stenosis mean? What is the treatment, doc? Stapedectomy. A 55-year-old, endoscopy shows a mass of the vocal cord found to be T1N0. What is the treatment of choice? Radiotherapy. See, doc, the most important factor that decides the ultimate survival of laryngeal cancer क्या है बताओ? The status of the lymph node. So whenever T1N0 of the glottic larynx is there, treatment is a big controversy. You can do radiotherapy, you can do transoral laser resection, or you can do open partial laryngectomy. Any of them are the options. But if you do open partial laryngectomy, the quality of the voice is bad compared to either radiotherapy or transoral laser resection. There is no role for chemotherapy. So finally, it boils down whether radiotherapy or laser resection. Once more, it all depends upon the individual surgeon's experience and choice, and the individual patient is what you need to remember. So what is the treatment of unilateral vocal cord paralysis, doctor? We need to do speech therapy. To prevent synechiae, if you happen to do the dacryocystorhinostomy, you will be using mitomycin, is what you should remember. If you do a retroauricular incision in children, you may hit on the facial nerve. So that's the reason facial nerve injury is quite often seen. Cochlear implants, they convert what energy to what other form of energy. Sound energy को electrical impulses में convert करेगा cochlear implants. Eticoantral CSOM, typically you do is an indication for modified radical mastectomy is what you should remember. Pott's puffy tumor होता है, osteomyelitis of the frontal bone, antimicrobial resistance. What is the reason? Because of the biofilm formation. Glass blower होता है, infrared, not ultraviolet. Jack-in-box scotoma are those optical aberrations which are seen in the guy who is using spectacles for the correction of aphakia. Posterior subcapsular cataract. Typically, once you do the extraction of the lens inside, the posterior capsule can develop the opacification. That's called after cataract. So, ionizing radiation, Wilson's, myotonic dystrophy, anything can lead to posterior subcapsular cataract is what you should remember. So, whenever a part of the eye is chronically inflamed or if the person is using steroids, that lead to posterior subcapsular cataract is what you have to remember. If you want to know the visual outcome after phaco surgery, you use acutiometer, which is the investigation. Oldest cells are there in the nucleus. So the lens posterior surface is connected to capsule by what are called hyalideo-capsular ligament of Vega is what you should remember. Apologize me that I am really running very fast with you because you all have taken 3.5 hours time to answer the marathon of the grand test. Already it brought an insight to you. What are the areas where you are missing, where you need to improve? They are the important insights that you need to get with every full-scale grand test. So that is the reason I am trying to run a little fast, right? Seashore sign. Wow. In the lung. So doctor, power for nuclear fragmentation in phacoemulsification typically comes from the ultrasonic. In glaucoma, whenever you are doing triple surgery, what are all the things that you do? You do trabeculectomy, posterior capsular IOL implantation, extracapsular cataract extraction. They are all the parts of the triple surgery for glaucoma. Endophthalmitis means what? Uvea, retina, vitreous. Their inflammation is basically called endophthalmitis. Sudden, two types of sudden grading. Nerve injury का भी classification sudden ने किया, axonotmesis, neurotmesis, that is sudden classification. Even Pott's paraplegia classification is done by the sudden. What is the most common cause of the avascular necrosis? Whenever most common पूछा idiopathic भी है, that becomes the most common. That's a thumb rule. Dashboard injury में there's a posterior dislocation of the hip, sciatic nerve get injured, avascular necrosis of the hip can be a late complication. They're all two statements. What is the role of anterior cruciate ligament, doctor? It prevents the anterior motion of the tibia over femur, not femur over tibia. It provides secondary varus valgus stability. It becomes very taut when you extend the knee. So it prevents anterior displacement of tibia, prevent hyperextension, prevent medial and lateral rotation of the tibia, prevents posterior displacement of femur, is what you should remember. Gustilo Anderson grade 3 injury, how do you like to classify? Grade 3 means whenever there is an open segmental fracture or an open fracture with an extensive soft tissue damage, any traumatic amputation, that comes under grade 3. Grade 3 होता है extensive soft tissue damage. So you should be very sure, a lot of times this question came, Gustilo and Anderson's classification. What is the total duration of antibiotics in osteomyelitis? 6 weeks. Now, for congenital talipes equinovarus, we do Dwyer's osteotomy, posteromedial soft tissue release, triple arthrodesis. They're all done for CTEV. Manipulation, serial casting, recording the deformity to look for the improvements. Ammaji is asking, sir, tomorrow 500 MCQ game. Old model or pole model? अच्छा, अभी 2 मॉडल्स हो गया हमारा. कल परसों हम ओल्ड मॉडल पीपीटी में चलाएंगे. From day after tomorrow onwards, we will try to adopt to the pole model so that you have that fighting spirit. That is an advantage. So, Justice Majumdar, what is to be corrected in CTEV? Very good. AIE, remember, All India Entrance Exam. Adduction, inversion and equinus. This is the typical order, is what you need to remember. So, what is the today's question on clubfoot in AIMS exam? Majum. So, you will do posterior medial soft tissue release only at 1 year. That's what you need to remember. Butterfly rash in SLE. Wow, Monteggia fracture भी पूछ लिया, बढ़िया, very good. Then what is tough about the paper? So, cheeks, lower eyelids, bridge of the nose, you find butterfly rash. Vitamin A overdose lead to pseudotumor cerebri. Oh, equinus is the one which is corrected last. First, adduction, inversion, equinus, lastly. So it is a false statement. So, iron accumulation, basal ganglia is called Heller-Burden-Spard's disease, is what you need to remember. Prader-Willi syndrome, obesity will be there. In them, the ghrelin will be typically elevated. ADH, what does it lead to? It acts on distal convoluted tubule, neurosecretion, post-operatively it is produced. But when person is dehydrated, when his plasma osmolarity is increased, that is the time you get the antidiuretic hormone, is what you should remember. Patient is on amphotericin B, serum potassium 2.3. How much amount of potassium देना पड़ेगा? Very simple. For every 1 milliequivalent per liter decrease below 3.5, the requirement will be between 100 to 400 milliequivalents. So if you give 10 milliequivalent potassium, it will correct 0.1. So what is 2.3? So 3.5 minus 2.3 is 1.2. 1.2 into 10. 1.2. 1.2 में कितना 0.1s हैं? You are having 12.1s. 12 into 10 होता है 120. Nearly 140 is what you need to give potassium supplementation. अच्छा, जस्टिस मजुमदार बताना है आज के एम्स नवंबर में. What was the question on one of the dyselectrolytemias? Definitely he must have asked. Hypocalcemia, hypercalcemia, hyponatremia, hypernatremia, hypercalcemia, hypocalcemia. What is the question? Very good, very good. Varun is saying, sir, after transsphenoidal hypophyseectomy, which hormone need to be supplemented? Very good. Yeah, we will take up a detailed discussion, doctor, no worries. So, Barter's syndrome, hypokalemic periodic paralysis, and juxtaglomerular cell tumor, you find hypokalemia. But when will you get hypokalemia, doctor? Typically, suppose if reninoma is there, high renin lead to high aldosterone. What is the effect of aldosterone? Typically, aldosterone will lead to retention of sodium and loss of potassium into urine, leading to hypokalemia. Whereas 21 hydroxylase deficiency there is a mineralocorticoid deficiency. If there is no mineralocorticoid, potassium won't go into urine, it will be retained in the plasma. That's the reason in 21 hydroxylase deficiency, what do you get? Hyperkalemia is what you typically come across. So फटाफट बोलो, Bartter syndrome में क्या होता है? Hypokalemia, metabolic alkalosis, polyuria, polydipsia, urine calcium excretion is increased leading to nephrocalcinosis, but there is a normal magnesium is what you have to remember. Aplastic anemia, short stature, pancreatic exocrine failure, इस combination को बोलते हैं Schwann-Diamond syndrome is what you should remember. भैया fresh frozen plasma में you have all clotting factors. You have all clotting factors. Very good. Raghav 7 is saying, Sir, patient with hypokalemia, ECG graph given. Definitely. That's what examiner, what else he can do. Similarly, SIADH में vasopressin challenge. Excellent. So doctor, it is stored at 18 degrees, given for the reversal of warfarin toxicity, and ABO matching is mandatory because it is blood. So fresh frozen plasma has all coagulation factors, albumin, plasma cholinesterase, frozen for 8 hours and can be stored up to 1 year at minus 30 degrees. So 1 year at minus 30 degrees is good, so that factor 5, factor 8, their loss will be very minimum, is what you need to remember. Now, Faggot sign क्या होता है? Hyperthermia में bradycardia is called Faggot sign. Diphtheria में लोग क्यों मर जाते? Toxic cardiomyopathy is responsible. अच्छा भैया बताओ, आज के नवंबर एम्स में मोनोक्लोनल एंटीबॉडी ab कुछ आया क्या? So monoclonal antibodies to CD25, that is interleukin 2A receptors. Where do we use them? Typically in kidney transplant rejection, even in bone marrow for the graft versus host disease management. So basiliximab, which is anti-CD25, very good. Varun Ramana is saying omalizumab ab के बिना NEETPG नहीं होगा, एम्स नहीं होगा. अगर नहीं पढ़ के गए तो हम डॉक्टर मुरली भारद्वाज का साथी नहीं हैं, right? So you should promise me. Preparation for entrance exam is very simple. If you get that consciousness, what examiner is going to ask, what are those topics जिसको आप गर्मा गर्म पढ़ना चाहिए, right? So anti-CD25 monoclonal antibody basiliximab is used to prevent graft versus host disease in bone marrow transplant. Similarly, anti-CD25 monoclonal antibody, it is typically used as an immunosuppressive induction therapy in case of renal transplant. Renal transplant. अम्मा पूरा बट्टी मारने वाले टेबल्स को एग्जामिनर ने होलसेल में पूछना शुरू किया. मैच द फॉलोइंग, मैच द फॉलोइंग, मैच द फॉलोइंग, राइट? हाँ. So is there any PDF for NEETPG? Very much, Shiva. Please call our helpline 9000-868-356 and ask for 953 topic PDF, high yield topic PDF, and you will get it. Also, get yourself included, Shivaji, included into the WhatsApp study group. The most common cause of the preventable hospital death होता है acute pulmonary embolism. In polyarteritis nodosa, there are a lot of nodules which will be forming in the skin, which are clinically palpable, and even the chain of beads or chain of lakes appearance is the classical feature. Finally, doctor, before we call it a day for today, wonderful evening, some of you since morning had been attending from 10 a.m. onwards, took the test. Thank you for participating. Please also tell your friends to join, right? So don't forget, December 1st to January 4th, हम रुकेंगे नहीं. We will fight on the sea, we will fight on the hills, we will fight on the plains, we will fight until our self-respect is restored. So we are going to fight to become the topper in the NEETPG. Right, Doctor? So December 1st to January 4th, every day morning 10 a.m. to 2 o'clock. You have a poll everywhere, a grand test. After that, there is a discussion with Dr. Murli Bharadwaj of the test paper. So that is going to become our routine program. And after the test is over, we will decide 10 topics, promise ourselves that we will master them, and then every day we need to keep on improving. Right, Doc? So, once more, thank you very much for joining this session. Muller-Red meningitis is seen in the case of the herpes simplex 2 in most of the cases. It is a meningitis due to viral infection, aseptic. Multiple times it occurs. Repeated episodes of meningitis lasting 2 to 5 days, occurring weeks to years apart is what you have to remember. So, doctor, I want to tell you, it is all about a clear diction, positive focus, at least spending. I promise you all that every day 2 hours I will conduct a live online interactive session with you to inspire you to add a little fuel into your energy and preparation. Already you have 2 lakh PowerPoint slides, 1000 plus hours of video lectures, 953 topics, 30,000 MCQs discussed and made available in the online mbbs.com video library. Please take every opportunity to quickly revise those topics where you are frequently going wrong, and just you need to improve. 150 to 200 topics you need to improve. That's the only thing that you need to do for the tomorrow's exam. So please call our helpline. They will be more than happy to assist you, and also be part of our WhatsApp study group 9000 868 356, and for the next 45 days you can get at a throwaway price subscription to the entire video library, grand test, discussions and everything. Enjoy a great Sunday. We will once more join with a renewed energy morning 9 a.m. tomorrow. Thank you.